but tonight we are thrilled and excited to have Dr. Deb Torraca talk to us. Dr. Torraca has her own wonderful business in Connecticut, Wizard of Paws, has been doing this for many years with many, many letters, and she's also does a lot of great teaching. So I thank her for spending time with us tonight, and we're going to kind of have an open discussion dash talk. I have the chat open, so feel free to unmute and chat with us. Super casual, ask questions. We want to try to focus a little bit about learning about how she's worked with her DM patients and adding some shockwave, but don't be shy. If you have other questions, please ask, because she's a wealth of knowledge on this subject. So with
Thank
that,
you.
I'll turn it over to Dr. Deb.
Hi, thank you, Cindy. Thank you for that intro. And yes, so as Cindy said, I've been doing research with degenerative myelopathy, mostly centered with laser or photobiomodulation, and receiving really improved results with higher dosages of laser into the paraspinal region from thoracic down to lumbar. And at some point, I've had a couple of shockwave units now for, I don't know, 3, 4, 5 years. I'm not even sure. Pre-pandemic, I don't even, the pandemic like was a blur. And started to like think about, okay, what else can we do for these patients? And thinking about what shockwave does, and if we can bring more blood flow to that area, can we, we know we're not going to cure these guys, but can we make them, their quality of life better? Can they live a little bit longer? So started treating them with shockwave. Some cases only shockwave, some both laser and shockwave. And then whenever I talk about this topic, I always try to just remind practitioners that this is an entire dog. So they're usually older. Unfortunately, they're usually those breeds that are a mess, like your German Shepherd, your Berners, all of that. And they have a lot of other issues that could just kind of, make them worse. So for example, like a German Shepherd with DM. Yeah, we're dealing with DM, but we've got painful hips. Maybe they also have lumbosacral issues. Maybe their elbows are, not the greatest, and their triceps are compensating. So, looking at that as the whole dog. And I get excited when a DM dog comes in, but my staff knows, like, don't say it's just a DM dog or all they have is DM, because there's certainly other things we can work on. And I don't treat all the areas in one treatment session. I'll typically, when I first get a dog in, I'll look at compensatory issues. We'll look at the radiographs, determine everything that's going on and our goals. So are our goals just to increase blood flow? Can we get any axonal growth? Can we get any more neurological activity there? And then also, can we reduce pain in the other areas? So, huge with initially starting with the triceps and your trigger points or your tender points, whatever you go by, and utilizing shockwave on those areas. I also like to shockwave the hip adductors. These dogs are crossing so often from the ataxia. We're not going to cure that ataxia, but can we give those hips a little bit of relief? So get those muscles to relax, and especially if they're going to be put into a cart or they're using a help them up harness, if we could get those adductors feeling a little bit better, we'll get the dog to relax. And again, with the goal of best quality of life for longest time possible. looking at that. Um, and then and that's combined with a multimodal approach. So certainly there was the study done by Kaufman years ago looking at that multimodal, or really the exercise component, I should say, range of motion and exercise improves the longevity. And so we will certainly add in a great deal of core strengthening, underwater treadmill. We do a lot with snuffle mats, not only to keep them occupied, but also the snuffling will help assist with the respiratory muscles. So that's always something I love to do and recommend owners get that, at home. Um, so questions with all of this. I'm talking like I've had caffeine, but I haven't. Um, but what are you seeing and what do you want to know? And if you don't want to say anything, you can put it in the chat box and I'll look at that and answer it too. Because I think DM is it's definitely a tough situation because we know what the outcome is and we're trying to be supportive of the owners and do everything that we can, but it's still tough. And if I could get just a few more months of that animal being in good shape and being strong, and that's what I have found initially with the higher doses of photobiomodulation. We'd almost see an improvement with the DM dogs, and owners would get excited and say, well, maybe it's not DM. Of course, we were just, getting some improvement. But then I noticed adding the shockwave in, we're also getting that little bit of improvement, and if we can, again, get them standing, get them moving better, we're going to just improve that longevity of life there. So questions, go ahead and whatever you want to do, chat. If you don't want to use your voice, you can use your words
I
or
have,
anything.
I always have a question.
That's okay.
So in working on them, obviously all the compensation issues, do you ever go back to the back and where you have lasered?
Yes. So great question. So sometimes I will do both. So I usually will laser first and then shockwave. I found that I'll get the best results from that. I may also um, shockwave in a little bit different areas. So I may want to target the laser at that thoracic spine and then utilize shockwave for the lumbar area and those hips and things like that.
Okay.
Yeah, I see the comment. Yeah, the snuffle mats, I highly recommend them. We started using them during COVID, to keep animals occupied and all of that. And then, just watching what they're doing and has been just a home run with our older dogs, our DM dogs, all of that. So that's been great. And I laughed with my staff or my office manager, who Cindy knows. I said, oh, we can make these and sell them. And then she looked up how to make those things and she's like, you are not doing that. I said, okay, that's fine. We'll send them to a nice pet store down the street to buy them. And I received a question the other day. I don't have laser. I just have shockwave. Can I just use that on our DM dogs? I said, absolutely. Again, when we look at the mechanism of treatment, we are increasing the blood flow. We're, helping with all of that. So you can certainly use that. And again, targeting that cranial thoracic spine and the lumbar spine. And then, of course, looking at everything else there. So,
And then
yeah,
when you charge, you're using a one charge fits all, right?
right. So we do. And typically, these dogs in my clinic, we charge per time, and it's either 45 minutes or an hour. And we label them as intermediate or advanced treatments. And just about all, there's a couple exceptions. These DM dogs are the advanced. So because we're spending at least an hour with them, and I've just found that charging per modality is not I feel like owners start to dictate what they want to do. And now even insurance companies, some of them want it broken down. How long did you shockwave? And almost very similar to human insurance and human medicine. I kind of said, oh gosh, we're going that way.
Way
But,
down.
Yeah, yeah.
you
Um,
know,
but for those of us, which some of us do, have to charge by modality, would it make sense to do kind of a different type of charge for this?
mm,
Is kind of the way my
yeah,
brain is thinking, because it's an at like it's super important, but you don't want to overdo.
right. You definitely don't want to overdo. And thinking one of the insurance companies that we had to break it down and where getting we do a combo charge. So and we broke it down in areas. So how many spots did we laser? How many spots did we do shockwave on? And each spot equated to, like, I think in the insurance world, like 5 to 7 minutes or something like that. So, you can definitely break it down like that, you know, with that.
Yeah, the billing is
Hey.
always
Yes.
Hi, guys. Thank you so much for giving this presentation. I do have a couple questions.
Sure.
First, for Shockwave, when I'm doing that pinpoint treatment on, that biceps tendonitis or something, I'll do once a week for 3 weeks. How often are you going to shockwave these guys?
Yeah, really good question. So I really try to encourage the DM dogs to come in twice a week. So if their chauffeurs can get in, that would be great. I may be shock waving them twice a week, but maybe not the same area. So I'll sort of split it up. If I know that I need to get their hips and the adductor region, the triceps, I'll split it up. So kind of the answer to that question is once a week on the spinal area, but treating the other areas on the other visit and then maintaining the laser for that. So, and if they can only come in once a week, so then we do as much as we can in that time span. And I always want to make sure we leave room for the core exercises, the water, all of that. I feel that that's such an important component of the treatment as well.
And do you continue that for weeks, months, or?
So usually these guys will stay with us for a long time. As long as the owner is willing to have them come in, and we may, change things up. We may just take a break for a week or so. But yeah, especially with trying to maintain their core, we have them continue to come in even if they're in a cart, really as long as the owner will bring them in. So yeah, we maintain that, and we may be targeting different areas as more and more of the myelopathy hits. We're working more on the forelimb, the upper cervical area, the upper thoracic area as well. So every owner, I always think that, okay, this owner is only going to, go this far, and they surprise me. And, so we try to encourage that, to have them come in. And I find that the dogs just do better because we're on top of everything else that's going on in their life.
Thank you very much for your answers.
Oh, you're welcome. And I know there's a question here from Lindsay. Excuse me, when treating the spine with shockwave, do you find you need to start with or maintain a very gentle treatment to prevent neural fatigue? And I treat with very gentle treatments, if you will, anyway. Um, so I always laugh that with our CCAT program with NC State, I teach with 3 men that are like, let's see how strong we can make the shockwave. And they're trying to make their, hair curl or whatever. But I'll typically start, if you're using the elevation unit, maybe on an intensity of 0.5 to 1.0 around that area, because you're right, we don't want to get neural fatigue. I also don't want the animal to all of a sudden have this activity and they're up and they're moving, and then they have more fatigue just overall. So that's a really good question. Because we want to make sure that we have all we're doing everything to conserve their energy there. So yeah.
Thank you. That's really helpful. Do you also limit the number of pulses with that?
It honestly depends upon the size of the dog. So, let's say I'm starting out a German Shepherd. I'm trying to think of the length of their back and the areas. I may do anywhere from 1,500 to 2,500. A smaller dog like a Corgi, I'm probably keeping it under 1,000. I don't think, again, we don't want to saturate the area, and I always feel less is better. And then we'll determine how did the dog do after the treatment and how did everything go. So, and then kind of adjust from there.
Thank you so much.
You're welcome.
I
What
think
is, hi, Charlotte again. What
Yeah,
is
no.
your experience in seeing, if you are doing the spine, are you seeing any dogs get worse the following 24 hours? What's your experience in that?
Yeah, that's another good question. So usually not, but I'm treating very low. So, I mean, we're always worrying is something else sitting there like osteophytes, are the facet joints arthritic? And, I'm sure they are. So we don't want to, for lack of a better term, blast those guys and cause discomfort. So, I talked with a practitioner a few weeks ago that was kind of following what I do, and she had the intensity up very high and was finding that all the dogs were pretty sore for 48 to 76 hours after the treatment. And we don't want to do that, in general, but especially with these cases. So just always less is going to be more. Um, and working, so we're not getting that fatigue or the soreness or anything like that. Sometimes when you're treating that adductor area, you may get a little bit of soreness there, and it's more to the touch. It's not really a functional soreness that we'll see, um, if that makes sense.
It does. Yeah, and when you do the spine, are you doing lateral to midline bilaterally or over spinous process?
So I'm going lateral on each side.
Okay.
Yeah. Yeah. And then, again, blood flow. I always think about those paraspinals, they're compensating, they're sore. So, working on that and coming down both sides.
so. When we talk about the dosing, I think that Dr. Traka made a really good point, and perhaps I find one of the harder issues is the communication post-treatment
Mm.
and knowing what they saw and that they do see what's real. So, dosing is always going to be a little tricky with shockwave and not going to be super simple. But the communication and the follow-up with your patients the next day or the next couple of days, or at
Right.
least them keeping track of it so they remember to tell you how they felt
Mm.
before they come in, because adjustments are important. And if you don't, if the dog was down and out
Mm.
2 days and you don't know that, your adjustments aren't going to be appropriate. So, patient goals, yes, and also patient communication is always I think, important part of our follow-up.
Yeah. And I'm sure every one of you has different follow-up methods. And we have a cell phone that we just use for texting for all the clients. So especially with these DM dogs, I want to check in the next day, because owners can forget, or they can say, oh yeah, they just slept, for the next 3 days, which we don't want either. And I think I always tell owners the stress, the activity, the maybe a new place, or if they're just having a blast, they can go home and rest for 4 to 6 hours, and that's the legal kind of limit. Anything else, then I really need to adjust that treatment, and we're keeping track of that. So yeah, really good point, Cindy. Other questions? Everybody's got their
When you do pick the points laterally, are you kind of aiming for that disc space region, IVF region, or
probably
where?
more the facet joint. So coming in like this, if that makes sense.
Yeah.
So kind of going in that way. Yeah. And I know someone has a question. I know this is supposed to be about piezo wave, but I have a question about laser. Increasing the amount of joules to 15 to 20 joules per centimeter squared. So, or using the blood flow, tissue repair, and muscle strength. So it will depend upon what laser you have. If you have the multi-radiance and the priority principle, and either on the Alphavet or even Pro Shower and the Activet Pro. So that will have the same thing, the blood flow, the tissue repair, and the muscle strength. One of the things, just depending, and you have to look at your laser, like some of the DM protocols on the laser are really long. Looking like a German Shepherd, that it may be a 25 to 30-minute treatment. And I just think that's a lot. And at that point, are we, just causing that neural fatigue? What are we doing? So again, just depending upon what laser, you're looking, at. Another question about do I prefer the radial or the linear head? I love my linear head, but it depends honestly on the size of the dog. So if I'm working with a German Shepherd and I want to get a lot of different areas, I'm going to go towards the linear head. Smaller dogs, I'm going to use the radial head. So I think, look at the size of your dog, what is going to work. Usually I'll switch to the radial head when I get to the triceps, the adductor group, just depending again on the size of the dog and what we're doing there.
So I'm gonna interject just for verbiage. We want to try to keep it as the focus pinpoint head or the round head. Radial implies radial
Right.
shockwave, and
Mhm.
radial shockwave is not focus shockwave. So just for verbiage, we're actually talking about the F7G3 round focal head, because I don't want to get people mixed up in radial versus focus
Right,
shockwave.
right. Very true, very true.
Going to be very dependent on what you're treating as to which head, I do believe. Yeah.
Yeah. Yeah,
Yeah.
no, definitely. And the size of the dog and, your comfort too. I have some of my staff that they love the linear head. A couple of the others just don't like it because it's a little bit heavier and they find that's a little bit more difficult to navigate and use. So, but yeah, you could, I mean, I think I wouldn't use a linear head probably on, a tiny corgi with DM, with maybe a giant corgi. But I don't know. I'm looking at my little Brussels Griffon. He would not, no linear head on him. Other questions and what you're doing or anything with DM? Has anyone tried something that is working fantastically? Some magic? I'll tell you a kind of a funny story. When I was just starting out in rehab, so I live in Connecticut, and this gentleman had driven to me from New York with his Alaskan Malamute, and he was told the dog had DM. And I said, okay, didn't really know the dog that well. I mean, he definitely was demonstrating some signs of decreased CPs and a little bit of ataxia, but he was mean, just like mean, nasty, all that sort of stuff. Just, not a nice dog. It's like, okay, I'm going to see this dog once, set him up on a home program, get him the help that they need. So 2 years go by, and I hear from the owner. He's since moved to the Cape, and he said, I'd like to bring my dog back to you for an update. I'm saying 2 years. Wow, this like is either like a miracle or the dog does not have DM. So brings the dog in, and dog looks just like it did 2 years ago, more ornery now. And I said, why don't we let me talk to your veterinarian. And because at this point, I think the Malamute was like 10 or 11. And I said, what if we just ask your veterinarian to try an NSAID and pain management? And sure enough, like, the dog was ornery because it was in chronic pain, was having a lot of issues that mimicked. So again, decreased CPs, ataxic, and just had been living, with this. But the gentleman loved his vet in New York and said, no, like to the day that dog died, he said, you could do whatever, but my dog has DM. And the dog lived for 5 years with a diagnosis of DM. And I think, okay, whatever, we'll go with that. We got the dog to feel better. So that was the big thing.
That's crazy.
Yeah. Yeah. I always remember that because I was like, I'm going to die by Alaskan Malamute.
Um,
Other questions that anybody may have?
would you recommend doing 1 point per joint with multiple probe heads for varied depth, or multiple points of a joint with the same
Hmm.
probe head?
That's a good question. I'd probably do multiple points of a joint with the same depth probe. Yeah, I'm trying to think on a joint that I would switch.
I think this goes back to
Mhm,
discussions we've had for stifle joints.
mhm.
And what tissue are you trying to hit in the joint, and what is your purpose of the joint? So if you're hitting the synovial fluid for OA, you don't need, you can use one depth, but I do have some groups who might want to hit the subchondral bone for cartilage
Mhm.
protection, or come even more shallow and hit just the joint capsule for the kind of capsulitis. So I do think the decision can be based on your purpose. Does that make sense?
Yeah. Yeah. And yeah. And also I'm thinking, so yeah, exactly. So you're looking at the tissue, and I think the stifle is a really good example of that. So, we're treating the medial joint line. There is, it's the tissue, the depth that you need there is very minimal. But then when you go, I always like to treat the distal hamstrings, and that we're going to need, a different depth probe because the tissue is much thicker there. And, same with that. So Lindsay, I don't know if I have a different owner belief standards when to consider humane euthanasia. So, and yeah, it's definitely the whole, belief system with euthanasia. And, I think the worst DM case I've ever seen was a Chessie. And she started with issues and was pretty down. She was in a cart, and I actually went out on maternity leave and came back like 8 weeks later. And I had just assumed that um, it she was going to be put put to sleep, and no, not yet. And she was only able to move her head. And that's the most progressive case of DM I've ever seen. Um, owners are definitely going to, change like what they're, some as soon as there's a slight bit of incontinence, they want to euthanize. And, of course, we support whatever they want, and others that will go that length. But yeah, that was the longest I've ever seen a DM case, because I've wondered, like what would happen and what would it look like? And that's what it looked like. And she started to have some respiratory issues, and so they finally called it, which at that point I thought went a little bit too much. So yeah, it was memorable. Definitely memorable.
That sounds awful. Thank you.
You're
Sure.
welcome, Lindsay. I know. And I think too, like different clinics that I talk with, I mean, some are, the DM diagnosis comes across and it's kind of set up like, in the next 2 months, prepare to euthanize the dog. And other clinics are, I don't want to say hopeful, but, just giving a little bit more information and options and all of that. So it's definitely, the vet culture and all of that. Other questions?
There must be questions. There's 16 other people than me on here.
I have,
Um,
I have another question for you guys. Are you guys working on any sort of research project to kind of support these ideas, or do you have any that you could send us that kind of show it? I know it's so hard to do research in DM dogs because it's so hard to find a control group, but what
Right.
are you guys working on?
I think Cindy and I have talked, and we have cases that we can write up about, because we're speculating that, okay, this is improvement. We are maintaining functionally and all of that. I know from my clinical standpoint and the whole function and what we're looking at, we see improvements with, certain protocols, but yeah, we need to get more out there. And it's a tough group to even been working with different forms of laser, different treatments before I really started using shockwave with them. And, it probably took about, I don't know, 9 months to get 12 dogs with DM in. So there a lot of owners don't want to pursue that and go the rehab route, unless you team up with a neurologist that can confirm everything. So I think that's why these things are so good to start talking. And when you guys start treating, you could give Cindy case studies. So,
case studies are kind of where we have to start. I think the other very hard thing with DM is what can we measure, which is length of life post diagnosis. And it's a hard thing to keep track of, and it's a hard thing to make a lot of comparisons from, because everybody has a different stage of euthanasia also. So it's not a simple thing to study. And I mean, nothing is, but this
yeah.
makes it harder. But right now, in the rehab world, there's a lot we have to use our, I think this was a good conversation I had with Dr. Pierce, was use our understanding of tissue biology, disease process, and then what we are putting into the dogs to make
Right.
appropriate decisions at this point. So
Yeah, absolutely. Absolutely. And Stephanie, you're fine to ask your question. Um, Are you doing laser and piezo wave both on the spine, or only using piezo for comfort when needed? So both. It will just depend upon the dog and what I'm finding. And I may start initially with photobiomodulation and use the shockwave to treat our tender points or compensatory points. And then I may just work with only using the shockwave on the spine or doing both. So kind of depends. I may try to get work on the photobiomodulation on the thoracic spine and use shockwave on the lumbar spine, just again making them feel more comfortable and all of that. And Samantha, your question here, that yeah, DM is not painful, but these dogs, like the burner, they have a lot of other issues there. So it's so common to see LS disease and OA, and we kind of forget about that. And I think it's so important to, whatever, you feel from a pharmaceutical standpoint, from NSAIDs or pain management to work with. And I recommend that they stay on their NSAIDs. I don't want to take them off, especially if that's making them feel better and their ambulation is coming along with that, because they can definitely have a setback, and the setback may be seen as neurological when it's really orthopedic because of that pain in the area. It doesn't mean I'm not going to continue to treat either with shockwave or laser, but we're really, I don't want to say attacking the body, but doing everything that we can to make that animal feel better. So that's good.
So would like to add a little bit about the NSAIDs and shockwave. Because traditionally we were using shockwave in a much higher energy level that was creating inflammation to bring in healing. Over the last 4 or 5 years, it's been 5 years, we're really starting to understand more of the mechanism of shockwave in the terms of mechanical transduction, moving tissue and turning on the healing process. And that's not usually a pathway that the NSAIDs are going to affect. So in general, getting away from the concern of NSAIDs and shockwave nowadays, if that makes sense. And of course, even in your general senior population, I don't want to take my 12-year-old yellow lab off his Rimadyl to come get treated. So, and we are not seeing any difference in results if they're on NSAIDs and shockwave at the moment. And it's anecdotal, but the mechanisms are pretty solid when you dig into the physiological and biochemistry. So yes.
Yeah, no, and it's definitely, I mean, if you're utilizing gabapentin, and of course, gabapentin can have those side effects and may not work well with DM dogs, but if you have different options out there, and that's great. So Samantha, that's great. You work with anesthesiologists and a CCRP, so many things to do there.
Yeah.
Yeah.
Living in pain is not a fun thing for anybody, and I don't think any of us wish it upon our
No.
fuzzy friends either. So
No. And it is pretty incredible when, that these dogs come in and they've just been down, so they're painful. No one's really addressing their pain because it's DM. And then, you're looking at, you get them to feel better, you build up their confidence. I find that so many of these dogs, you get them standing in the underwater treadmill and they're like in space. They could move, they could stand, and you can almost just see them brighten up. They're feeling better. We're getting that strength back. We're getting their dignity back, and makes such a big difference.
for sure. Other questions, ideas, and we can go, Dr. Deb uses shockwave on a lot. I shouldn't say everything, but a lot.
Yeah.
So, if you have a question about another situation, please ask while we have her. And if everybody's totally informed in the world, we'll let her go and have her evening. So let me know.
And I'll put my email address in the chat group. So if you think of other questions, definitely reach out, or if you're on Instagram, like Cindy says, we always put like a bunch of cases on there and that sort of stuff. So on Instagram, it's wizard.of.pause. But yeah, anything, I'm always happy to answer, questions. And I feel we all learn this way. So it's great.
So Erin typed one in about treating over the spine. What are your goals?
Good question. So when working over the spine, so I'm not going
Beside the spine.
at the side of the spine. So we're not going directly over the spinous processes, but we're going on the sides. And two things. So, if the facet joints have any kind of arthritic changes, alleviate that pain and discomfort there, but then also blood flow. So as you had said, Erin, to get those effects of the neural tissue. So can we get more axonal um, growth and, a little bit more information, as I tell the owners. So excite that neural tissue. And again, not cure it, but kind of amp them up a little bit. I tend to see with the dogs, they may come in here, we go up a little bit before we have that slow decline. And so that's what we're looking with, and definitely treating on both sides of the spine, not over the spine. Any concern about exacerbating IBDD with treating spine? Do you also treat cervical? So typically no exacerbating IBDD with the shockwave. I mean, that's, that goes back to, we're going to make sure we're not aggravating anything and really, following up. And I tend to treat on the lower side. The cervical area, absolutely. I definitely, these dogs, I find that because they're so forward and they tend to have more of an extension up at the suboccipital area. So working in there and treating there, as well as the rest of the area, the cervical region does a lot of compensations. So, and that's such a muscular area. So can we turn off some of those trigger points? Can we get some good motion there, get them feeling better, there, get them out of this forward head posture and make them feel a little bit better. Yeah. And Deanne, so do you use by point or scan? So along the spine. And I will typically, I probably do a combination, as moving along, and I may find an area that the dog is like, that either I can feel that doesn't feel great, or, oh, that feels really good, and starts, pushing back into the shock wave. So, once I find an area, I'm going to hang out there for a little bit. Yeah. Good. That's a good question too. I find like everyone has their art of doing this. Sometimes I look at my text, I'm like, I don't do it that way, but the treatment is it's just as effective. It's, we're just kind of doing it in 2 different ways, or 3 different, or 4 different. So
Many, many different ways to get very, very similar results.
mm.
Awesome. Anybody else in there?
Well, I wanted to ask you guys a question about fibrotic myopathy, but I don't want to totally take away from this. But
Go
you said,
ahead. Go ahead.
okay,
Yeah.
just 'cause I know you, Debbie, you see a lot of or use a lot of shockwave.
Mhm.
With piezo wave specifically, when with these fibrotic myopathy dogs, Do you see good results, or are you kind of more relying on ultrasound for that?
No, we don't, we have an ultrasound unit. We don't utilize the therapeutic ultrasound. I will use shockwave on them. I think, I mean, they're tough cases. Once we can locate exactly where the fibrosis is and if the dog will tolerate it, I will shockwave and tend to go up a little bit higher here, just thinking about trying to break that fibrosis if we can, so I think in my head, if I can break it up a little bit, then follow it up right away with aggressive stretching. Um, oh, Cindy, you want to say something?
Well, I just got amazing videos for fibrotic myopathy,
Yeah.
which I was just like, wow. And I don't have, I obviously wrote back, can I get more details? It was a long time period. So I think another thing that it's not something you can give up on easily, and you have to have the time and budget to keep at it. But this was a shepherd mix. Went from almost looking ataxic from the fibrotic myopathy, like not picking its toe up well, and to walking normal in the water. Now it was in water, but such a dramatic difference. I believe it was a 3-month time period. So
Mhm.
again, it wasn't a fast, but they were very, very diligent and crazy results. And could it have been a one-off? Yes, I'm not going to say it's going to work for every single one, but I do encourage people to use higher energy because of the fibrosis, and two, talk to your owners. If they can be diligent, you
Mm.
could get a better result.
Yeah.
Makes sense.
That's
Yeah.
awesome to hear. I know that's a little off
No.
topic, but you said you treat a lot, and wanted to grab you guys with that question.
Yeah.
It's
No,
been floating around
definitely.
in my brain for a while.
Yeah, and I'll usually too with those guys see if the owner at least initially can really commit to like 2 or 3 times a week, because to be aggressive with it, but also they have to be stretching at home. They have to be doing the range of motion. I mean, they're tough cases. We it took we have a police dog, German Shepherd that belongs to one of the towns, and he had kind of just zebras of issues, a lateral meniscal tear, and then like 3 months later, he had that. As soon as I saw that little hang time hitch, I was like, ugh, this is what's going on. And to get him back to work, he's not at the prettiest gait, but he's functional and he's back at work. And it took, I want to say, about 4 months. And his handler was very diligent, and we all kind of attacked it. I'm interested to see how he goes, um, how he does throughout the remainder part of his career and his life and stuff. So, yeah,
That's awesome. Thank you both for your response.
you're welcome.
I just want to say, Deb's information is in the chat. Everybody should by now know how to find me. If you guys have questions, if you need more help with anything, please reach out, because the only way we can help you is if you tell us you need help. And don't be shy. I've had every question you can imagine. And we all learn from each other. So I thank Dr. Deb so much for spending her evening with us, and all of you for logging on. As usual, we do record, and it will be posted on our user forum on the website. But I thank you all for your time and your energy, and thank you very much, Dr. Deb.
Thank you. Bye, everyone. Have a great night.
Have a great night. I appreciate it.